Namaskar guys and welcome to Dil Diya Galan with Dr. Vanita Arora herself. Doctor, I would want to know, I've heard this and I don't know whether it's right and you'll be able to shed a lot more light on it. The cardiac health of men and versus women is definitely very different. The symptoms to a heart attack or heart palpitation are going to be very different for men. And how to identify that for both men versus women.
Adi, you are absolutely correct. The heart of a man and a woman is different, totally. Right? So, hence are the symptoms. Whether we talk of heart attack or we talk of palpitations, these are the two different systems of the heart, but the symptoms in men and women are totally different. Now, women are the backbone of our family, right? Whether it is in form of mother, wife, daughter, they are the backbone. And they are used to taking care of everybody in the house, but they always forget to take care of themselves. That's why whenever the symptoms of heart attack come in a woman, she tends to ignore them. Now, what happens is that you must have seen a picture in the magazine or seen it somewhere that heart attack means this.
Yeah.
You have a chest pain and you
holding the chest.
Absolutely, it's like a lot of weight on your chest. Now, in women, somehow the symptoms may not come as a chest pain in the chest.
Okay.
Chest pain in the center of the chest. They may come like a little lower down, or they may just have heaviness over the shoulders, or just something radiating to the jaw.
Alright.
So these are the different symptoms, and most of the time I've seen females avoiding it as gastritis, or apprehension, or because of stress, they are having a lot of shoulder pain and the symptoms go miss. So once the symptoms go miss, the heart attack has to be treated within the first hour of the symptoms to be started to get the best result and to save life. Right? These symptoms go miss in them. So they are supposed to be aware. One, they have to have a general checkup done. It is most of the time seen that in family, when it comes to health checkup or a heart checkup, it's the man of the family who gets that done.
Yeah.
The woman is generally forgotten.
Yeah.
People think they are safe because of the hormones in the female, like estrogens, progesterones, which are there, and as long as they are having their periods and they've not reached the menopause, they were supposed to be safe. But that is no longer true. We are having females presenting at the age of 25, 26 years with heart attacks.
Alright.
So things have changed. The safety is really gone. The shift has been there from last 2 decades, almost 2 decades. I contributed to the urbanization of our living styles, the stress that they have. They are into profession, so that level of professionalism and the stress which comes to take care of the family and to take care of their work together, and plus the incidence of smoking. The smoking incidence is so up in females that it has taken over everything else, and the incidence
that's another coping mechanism for them with the stress that comes.
Absolutely. And the most fatal is the combination of taking oral contraceptives and smoking.
Okay.
That is the thing.
So you're messing up with your hormonal activities.
Absolutely. You're increasing the incidence of coronary artery disease a lot with this combination.
Talking about heart palpitations, I believe it's different for men and women. And what are the symptoms and why we shouldn't be ignoring palpitations or irregular heartbeats as they call it?
Adi, palpitations as described are the heartbeat going fast. It may be regular, it may be irregular. Both of them will give you symptoms. However, the expression of symptoms in men and women, it varies. Okay, most of the time what I have seen is, and I have a lot of examples to quote, even in the medical professionals, that when a female has palpitations, her heartbeat is not normal of 90 to 100, it is going to 180 to 100 beats per minute. So the heart is not contracting like this, it's doing like this, it's going very fast, so the blood pressure falls.
Okay.
And most of the time when they have such kind of an episode, they're having sweating, they're feeling weak, out of energy. So either it is taken as anxiety or it is taken as depression.
Yeah.
And females, since it is a female, since females have more anxiety, since females go into depression very fast because they have their mood variation because of the hormonal things, it goes undiagnosed for years together, right? Because nobody looks at the to get a cardiac examination done during that time. Nobody sees the pulse. You just have to feel the pulse, and you will get the diagnosis.
So very high pulse rate could also lead to a low blood pressure.
Absolutely.
And it can just completely be forgotten that it's palpitation that's actually resulting
Yes.
a low blood pressure.
Right.
Okay.
And instead it is treated as anxiety and depression. I will give you an example here of a nurse. She was working with us in the hospital and in the emergency, and she would get these kind of symptoms. She was getting for a couple of years now. Nobody diagnosed her despite her working in the hospital. So I walked into the emergency to see some other patient, and she's a nice girl, young girl, who would be working around, running around the patients and doing her work. But what I found was she was just in a side, hiding somewhere and feeling very miserable. She was sweating and she was having a lot of, she was out of energy, sitting just in a side, hiding from them. And I just went to her, I said, "What's wrong with you?" And she said, "I'm not feeling good, I'm feeling very low." And all I did was, looking at her, I felt her pulse and I could see it thumping. It was like galloping of the horse. It was so fast. I took her out in the emergency table. We did her ECG. We found her heartbeat was 190 beats per minute that time. Her blood pressure was hardly 70 systolic. At that time only, we admitted her, took her to the lab, and we have a maneuver known as the radio frequency ablation, which takes care of the faster heartbeats coming from the upper chamber of the heart and fixes the heartbeat for life. You will never have to see a doctor again for this problem. This is known as radio frequency ablation. It's like doing a laser in the heart and taking care of the electrical system. And she was good to go. She never had that symptom again. This example I'm giving you is from 3-4 years ago, and she's been doing totally fine. And she was being misdiagnosed as anxiety symptoms and anxiety neurosis. It's very sad. It's very sad how women health never takes a precedence in the family.
So guys, and especially ladies, please don't ignore your heart health. Don't get misdiagnosed as anxiety and depression, and make sure to get your regular biannual or annual health checkups.